Robert Moffat is on the line. Dr. Robert Moffat, Ph.D., Director of the Center for Health Policy Studies at the Heritage Foundation, heritage.org, the website. Dr. Moffat, welcome back to the program.
Hi, Tom. How are you?
I'm great. I hope you are well, too.
I am fine, Tom. Just got back from San Diego in 3 weeks of surfing, so I'm in.
Oh, that sounds nice. That sounds really nice.
Yeah,
Okay,
so here I am in Washington.
So our question: why do Republicans want to destroy Medicare? Why is it that Jeb Bush is saying we need to kill off this program?
You know, Tom. Why do the Republicans beat their wives? Why do the Republicans want to destroy the environment?
Well, I don't think Jeb Bush ever said he wants to beat his wife.
Tom, let's stop. Stop it, Tom. Fact of the matter is nobody's talking about destroying Medicare. The President of the United States has said routinely that millions of Americans rely on Medicare. At the same time, the President said, look, we're spending too much to sustain the program. We must reform the system. We have to protect the current seniors. And if we don't, it won't be there in the future when future seniors need it. So we have to reform the Medicare program. Now, the President is absolutely correct. The question is, how do we do that?
Was not the woman who said to Jeb Bush when he said that he explicitly did say, you probably know the word, phase out. Yeah, he said we need to phase out Medicare and replace it with something where people can have some equity, essentially, which sounds to me like health savings accounts. And this woman said, I have paid into Medicare my whole life.
Right.
I mean, a 30-year-old right now who has been working since they were 18 has paid into Medicare for 12 years. Right. You're saying to them, A, your Medicare is not going to be here, and by the way, thanks a lot for the money?
No. The fact is what the issue here is, the woman actually said, I saw the clip, the woman said, this is not an entitlement, which of course is nonsense. Medicare is an entitlement. Everybody who is paid into Social Security and anybody who's on the Railroad Retirement Program is eligible by virtue of an entitlement to Medicare services. What Bush is saying to her, in effect, and what every economist I know, including people in the administration, will tell the woman, is that, in fact, she did pay into Medicare. But Medicare is a pay-as-you-go program, which means those who pay into it during their working lives, those people who pay into it now are paying for the senior benefits that are being delivered today. So it's a pay-as-you-go system. The problem is with this woman and a number of other people, and the Republicans and Democrats alike, is that they think they paid for their benefits. But in the same article, PolitiFact pointed out that, in fact, people actually get back 2 or 3 times or more what they actually did pay in to Medicare. So, in fact, people today who are on retirement or in Medicare are not actually paying for their benefits.
But if
that money has already been spent.
If you had been paying into throughout your entire working life into a stock fund, you would get back 3 or 4 times what you put in. Number one,
but it's not
and number two, how is that different from insurance?
Well, it is different from insurance in this sense. I mean, the Medicare is not, strictly speaking, an insurance program.
Sure it is. It's a single-payer insurance program.
It is a social insurance program. But it's a social insurance program which is based on a pay-as-you-go basis. There is no trust fund in which there is savings assets.
There doesn't need to be one.
Pardon?
There doesn't need to be one.
Well, no, I guess it doesn't. But then it's also wrong to say that you're paying for your benefits when, in fact, the money that you paid into Medicare during your working life is already gone. It's already spent.
That's a distinction without a difference.
No,
the system wouldn't exist if you weren't paying into it throughout your working life.
Tom, listen to me. It's a very big point because a lot of people misunderstand how Medicare is actually financed. Medicare is very popular, but a lot of people don't understand how it actually operates and how it actually runs. The truth of the matter is, as our friends at the Urban Institute, certainly no ideological bedfellows of the Heritage Foundation, have pointed out, people who have paid into Medicare during their working lives actually pay very little comparison to what they get out. What has happened with
Depends on what their
Medicare-
income is.
Pardon?
It depends on what their income is.
It depends on what their income is, but you're talking, as they say, roughly between two and three times, actually.
If you're making $20,000 or $30,000 a year throughout your working life, yes. If you're making $118,000 a year throughout your working life, no, you're probably going to get back less than you paid in.
No, that all depends, because Medicare, the problem with Medicare is not like Social Security in that respect. Everything depends upon your health care costs. You could, for example, be paying at $130,000, you could have that kind of an income and so on. But then at the end of the day, if you come down with something like colon cancer, you might cost the federal government as much as $1 million. So the payments that you make in Medicare during your working life are not really connected in any direct way to the cost.
Right, they shouldn't be.
That's
That's how insurance works, Robert.
The cost can vary dramatically.
But that's how insurance works. If I pay $100 a month into a life insurance policy, for 50 years and then die, versus 5 years and then die, and it's $1 million policy, my wife is going to get $1 million. And if I die in 5 years, you're basically betting with the insurance company and hoping that you lose the bet. Right?
But this is not.
I don't see the difference.
Medicare is not, strictly speaking, an insurance program. It is basically an entitlement, which is based on taxation. And the reason why Jeb Bush, made the argument that he made, or made the point that he made, is that it's not fiscally sound, is precisely the reason why the Medicare trustees, who have just issued their report last week, and just the same way that President Obama has said, is that unless we reform the program, it's not going to be there for
So what's your proposed reform, Robert?
What's my proposal?
Yeah.
Oh, I think that the best remedy is to expand what, in fact, is working very well in Medicare. We have a Medicare prescription drug program that is doing quite well.
For the drug companies?
Well,
in other words, you don't want the government to be able to
citizens.
Negotiate drug prices?
It's doing very well for senior citizens. If you look at the facts on the ground, both the drug program and the health insurance program have provided a very, very wide variety of benefits for people at stable prices.
But the drug that drug program, Robert, is a $630 billion over a decade gift to the pharmaceutical industry, because it forbids the federal government. And this is so weird, from negotiating prices. The Veterans Administration can say, okay, this year we're going to use 1 million aspirin, so we'd like them for a penny a piece rather than $1 a piece.
Right.
And the pharmaceutical companies say, okay, fine, we'll negotiate that price.
But
Medicare can't do that.
No, Medicare does not fix prices in Medicare Part
No, the drug companies do.
No, is a product of negotiation between private health plans and the drug companies, just like it is in private insurance, just like it is.
But it is not negotiated between the government, and the government is a larger purchaser of these things than probably any of the individual insurance companies, unless there's another merger and acquisition coming along.
You use the Veterans Administration program as a model, and I understand that. But the point is that, as our friends at the Congressional Budget Office have pointed out, if you want to use the VA as a model, it also means that you have to have a restriction on the drugs that are available to the senior citizen.
There's already that restriction.
Well, actually, no. If you look at Medicare Part D, the Medicare drug program, it's got a huge variety of drugs that are available at competitive prices, and that's just a fact.
They're not competitive prices. The federal government cannot negotiate with the drug companies for discounts. That's corporate welfare. I'm astonished that a conservative would be in favor of welfare.
Very good, Tom. But the point is that they don't have to negotiate with the drug companies, because the private health care plans in the private market, they do the negotiation for us.
Okay. Robert Moffat, I give you the last word. Heritage.org is the website. Thank you for dropping by.
Okay.
Good talking.